Welcome to Raaonline. Today's topic is clinical ART or assisted reproductive technology. Fertility is defined as capacity to conceive and produce an offspring, and infertility is a state of diminished capacity to conceive and bear an offspring. In contrast to sterility, infertility is not an irreversible state. Sterility is an irreversible state. According to the American Society for Reproductive Medicine, infertility is defined as inability to conceive after 12 months of frequent coitus. Infertility prevalence is about 12% in women and 10% in men. A woman of reproductive age who has not conceived after 1 year of unprotected vaginal sexual intercourse in the absence of any known cause of infertility should be offered further clinical assessment and investigation along with her partner. So, having said that, we should offer an earlier referral for specialist consultation to discuss the options for attempting conception, further assessment and appropriate treatment. When the woman is aged 36 years and above, it should be a candidate for earlier referral, and if there is a known clinical cause of infertility or a history of predisposing factors for infertility, she should also be given an earlier referral. Since the fertility potential of female decreases after 35 years of age, most authorities recommend initiating an infertility evaluation after 6 months of attempting conception in a woman who's aged 35 to 40 and after 3 months in a woman over 40 years of age. Women with known cause of infertility or women with amenorrhea should immediately start an evaluation to assess the cause and plan their treatment. Fecundability is the ability to achieve a pregnancy in one menstrual cycle, whereas fecundity is the ability to achieve a pregnancy that results in a live birth based concepts at conception in menstrual cycle. So, if somebody achieves a live birth in a menstrual cycle, it is called as fecundity, and if somebody is able to become pregnant in one menstrual cycle, it is called fecundability. Fecundability is 0.25% in a healthy young couple just beginning attempts at conception. Occult pregnancy is a pregnancy that terminates too soon after implantation that there is no clinical suspicion of its existence. Chemical pregnancy, a blood or urine HCG assay demonstrate pregnancy but there is no clinical evidence of pregnancy, is detectable by ultrasound. Clinical pregnancy, when we detect pregnancy as fetal pole in ultrasound, and of all the clinical pregnancies, even 20% will result in spontaneous abortion and they will not carry up to term. What is reproductive aging? There are hormones called as inhibin A and inhibin B. They selectively inhibit pituitary FSH secretion. They are secreted from the ovaries, the preantral follicles. Now, as the ovary starts aging, inhibin A and inhibin B production comes down and FSH levels rise. FSH levels rise progressively as inhibin production from the small cohorts of aging follicle decreases. Inhibin B is derived primarily from smaller antral follicles. So, as the follicle number decreases, inhibin also decreases with age. Circulating follicular phase inhibin B levels decrease even before FSH concentrations begin to increase. So, inhibin A levels also decline, but only in the later stages of reproductive aging after the onset of menstrual irregularity. So, the earlier marker to go down is inhibin B as compared to inhibin A. Follicular phase becomes shorter with reproductive aging, and rise in FSH levels will precede any rise in LH. So, first FSH rises and then only LH rises as the lady approaches menopause. Rise in FSH levels precede any measurable decrease in the estradiol levels. So, first there is a drop in inhibin B, then there is a drop in inhibin A, then there is a rise in FSH, then there is a rise in LH, and then there is fall in estradiol. This is ovarian aging. So, biological clock is the major adversary to human reproduction, and as we can see clearly in this picture, as the woman's age is increasing, the annual fertility rate per 100 women who are not using contraception is declining very fast. This is the WHO data of the live birth rates per embryo transfer by age. So, if we give 100 embryo transfer in the women of those age group, these were the numbers of live births achieved. So we see that as the woman is aging, the number of live births per 100 embryos transfer is also declining. There is something called cause-effect relationship and something called concept of association. Some diseases clearly have an effect-cause relationship with infertility, like azoospermia, bilateral tubal block, and anovulatory state will directly cause infertility. Whereas some disease processes where there is no clear cause-effect relationship between diseases and infertile state. In these situations, it is preferable to state that there is an association between disease condition and infertile state. Causality has not been definitely established. Example, stage 1 endometriosis. So, stage 1 endometriosis is associated with infertility, but stage 1 endometriosis cannot be said to be the cause of infertility. Whereas azoospermia, bilateral tubal block, and anovulatory state can be called as cause of infertility. Coming to the causes of infertility, so we see here that the male is responsible in 34% cases. The female factor of the uterine cervix is responsible in 3% cases. The uterine factors like fibroids, adenomyosis, polyps, septa, congenital anomalies is responsible for infertility 11% cases. Tubal blocks and pelvic inflammatory disease and endometriosis associated in non-functional tubes in 33% of cases, and hormonal causes like hypo or hyperthyroidism, Cushing syndrome, anovulation, all these are responsible in 29% of female infertility.